Today we're here to talk about the coronavirus. What is it? How likely am I to catch it? Can I give it to someone else? And is it really something that I should be worrying about? I'm Pamela D. Wilson. My website is PamelaDWilson.com. On there, you will find helpful information for caregivers, aging adults, and people who want to be proactive about health. Let's start by talking about the coronavirus. It's everywhere in the news. We hear about new cases somewhere in the United States or throughout the world every day. How worried should we be? Well, the facts are that the coronavirus most often affects two population segments, the very old and the very young. The commonality between these two groups of people is that they have chronic health diseases or they have weak immune systems, which means that they don't easily recover from things like the flu or a cold or the coronavirus. The coronavirus can progress into pneumonia. Pneumonia is another disease that affects the elderly and children. People who have chronic diseases, people who have poor immune systems who can't recover from common diseases. So let's talk about 100 years ago. 100 years ago in the United States, 1918, there was a major flu epidemic, a virus, much like the coronavirus. Millions of people died in the United States. Millions of people died in the world. The benefit of that experience, as tragic as it was, is that we here, at least in the United States, are more proactive about disease and virus prevention in the aspect of there's a flu vaccination that comes out every year. Older people are encouraged to get pneumonia vaccinations every year. Healthcare workers, flu vaccinations, other types of health vaccinations. There are universal precautions, which are things like washing our hands, cleaning surfaces. If we work in the healthcare community, sometimes it means that we wear gowns or masks or eye protection. We do other things to make sure that we're not infecting another person and we are not obtaining a virus or an illness from other people. Let's talk about some flu statistics. So flu statistics are from the CDC, the Center for Disease Control. This year, 34 to 49 million people became sick because of the flu. The range in deaths is anywhere from 20,000 to 52,000 deaths from the flu this year. Let's talk about pneumonia. Pneumonia, and these statistics are from the American Thoracic Society. 1 million people, on average, are hospitalized every year because of pneumonia. On average, 50,000 people die. So the number of deaths from pneumonia and the number of deaths from the flu are pretty close. There is another virus out there called the Norovirus. Again, who does this affect? Can you guess by now? Elderly people, children. The norovirus is a stomach virus, a gastrointestinal virus. Most of the older people who are affected by the norovirus live in nursing homes, and it spreads. Nursing homes will do what they call a lockdown, which means they shut the doors of the nursing home. No family can visit. Staff can come and go. People who live in the nursing homes are encouraged to stay in their wing of that nursing home or their unit so that the nursing home can perform infectious disease protocols to reduce the spread and stop the spread of the norovirus. We as consumers can do a lot of actions to protect ourselves. Hand washing. If we sneeze or cough, don't sneeze or cough out into the air. That is how the coronavirus and many of these viruses are transmitted. We sneeze, achoo, we cough. We are coughing droplets onto other people within a 6-foot range. Those people may get them on their skin and they touch their face or their eyes or their nose or their mouth. In goes the virus. Or if we're sneezing or coughing on someone, those droplets can be airborne. We can breathe them in. They go into our lungs. We acquire the virus. Older people and younger people who acquire viruses. They breathe it in, it can go into their lungs, it can transfer to viral pneumonia. The concern with viral pneumonia for older adults and for children is that our bodies have to heal it. Our immune systems have to heal that virus and the pneumonia. Antibiotics don't work. There currently is no virus for the coronavirus, even though many corporations are rushing to develop a vaccination. Vaccinations take time. It could be a year to 2 years before we have a vaccination for the coronavirus, which means that we as consumers have to be proactive about our health. 80% of the people who acquire the coronavirus, healthy adults, will recover. It's the other 20% on either end, the elderly or young people with multiple chronic diseases and poor immune systems that will be most greatly affected, and some will die from the coronavirus. People die from pneumonia every year. People die from the flu every year. People die from the norovirus every year. It just happens that this year, the coronavirus is the virus that is in the news. Now, the healthcare system, hospitals, nursing homes, doctors' offices, they all have protocols. They have protocols for epidemics, for pandemics that they should be putting into place. As consumers, though, we have to figure out what's best for us. Do I decide to get on an airplane with people who may be sick? Do I decide to wear a mask or not wear a mask? These are individual choices. Now, the healthcare system recommends that you do wear a mask if you have a respiratory infection, if you're sick, so that you are not infecting other people. But if you are an older person or a child or someone who is susceptible to diseases, you might consider wearing a mask to protect yourself from someone else coughing or sneezing on you. If you travel a lot, if you're a business traveler, you might decide to wear a mask on an airplane because airplanes are self-contained bodies of recirculating air, and you're close to people. You are likely to get sick on an airplane from sitting next to someone who is coughing or sneezing on you. We have to be proactive. The healthcare system is wonderful about treating us after we're sick. The only people that can prevent ourselves from getting sick is ourselves. We have to look in that mirror. On my radio program, The Caring Generation, every week I interview medical experts, amazing guests. We talk about how to be proactive, how to prevent health concerns, how to take care of elderly parents, how to take care of ourselves, how to take care of ourselves as caregivers. In life, we all eventually will become a caregiver for someone, and we all eventually will need care. That's the reality of life. The more proactive we are as consumers, as healthcare workers, the more that we seek out information about our health, our well-being, and do all of those little things like hand washing, the better off we will be. The coronavirus doesn't have to be something that we as a society are scared of or that we worry about every day if we're all proactive. The government, the healthcare system is doing what they can. We as consumers have to do an equal part in taking care of ourselves, in making sure that if we're sick, we are not going out and spreading illness to our elderly parents or going to a nursing home or a hospital where we can infect other people. We have to choose whether we want to go out in large crowds. The choices are ours. I'm Pamela D. Wilson, caregiving expert, advocate, and speaker. I help corporations educate working caregivers about the stress of caregiving. I educate all consumers about health, well-being, aging, and caregiving. More information is on my website at PamelaDWilson.com. More information is on my weekly radio program, The Caring Generation. I hope to see you on my website or soon in another video.